Hello, my name is Jennifer Wild, and I'm the director of SHAPE. SHAPE is an evidence-based well-being program. Put simply, SHAPE is sensible help for hardworking staff. Offering practical tools supported by science to help in the here and now, SHAPE treats post-traumatic stress and depression and can prevent these problems from developing in the first place. I'm here with Dr. Amy McKinnon, who's the lead wellbeing coach and psychologist for SHAPE.
Hello.
Over the last year, we have seen hundreds of healthcare workers like you. In this video, we're going to give the top tips, the top tools to stay well that have helped others like you. The first top tool is to overcome overthinking. You may question past clinical decisions or the outcome of efforts to treat patients. You may understandably dwell about what has happened on shifts. Research shows that this kind of thinking style predicts post-traumatic stress disorder. It can also cause our mood to plummet and can keep depression going. What does this mean in practical terms? Spot when your thoughts have turned to why, what if, or if only. This could be a sign that you're dwelling. Ask yourself, do my thoughts lead to a plan or action? Is this question answerable? Have I been thinking on this for over 30 minutes? Do I feel guilty? Feeling guilty is often a sign that we're overthinking our actions from the past. When you spot that you're dwelling, use this awareness as a cue to shift your attention away from your thinking and into the outside world. Experiment with what works for you. You may find it helpful to change your physical position, for example. So if you're sitting and you spot that you're dwelling, then stand up. You may find it helpful to engage your full attention in a new task, such as making a cup of tea with your full attention. Any activity that is going to shift your attention away from thinking and into the task at hand is likely to be effective in breaking the cycle of dwelling.
The second tool is called planning ahead. A number of studies have shown us that making a plan in the evening before the next working day improves well-being and reduces psychological distress. Before a shift, and if possible the day before, make a plan of how you can incorporate these brief breaks into your day. The idea is for them to be something enjoyable, so not something that involves taking care of other people or being productive. You might try 7 minutes of exercise, going and grabbing a quick coffee, playing a game, or leaving the hospital or station for a walk.
The third tool we wanted to mention today is to use then versus now for unwanted memories. You may find distressing memories of jobs or patients that you've worked with come to mind unbidden. The more similarities between jobs or patients that you're working with now and past jobs or patients you've worked with, the more likely memories may be to come to mind. This is normal in the aftermath of distressing events. Research has identified strategies that are helpful and other strategies that are unhelpful for dealing with unwanted memories. Studies with a range of professions demonstrate that intentionally breaking the link between the past event then and triggers in the present now by focusing on all the differences helps to reduce the frequency of unwanted memories. This is called stimulus discrimination, or more simply, then versus now. What does this mean in practical terms? Ideally, try to let the memory come and go rather than suppress it. Working hard to suppress a memory can sometimes cause it to come back more often. Sometimes very traumatic events from the past can intrude onto how we see what is happening in the present. If you spot this is happening, intentionally focus on the differences now compared to the event then. You may find it helpful to spot the differences, not the similarities, between the trigger now, and the trigger may be a similar looking patient, a smell or a sound or a sensation, and the event then. By focusing on all the differences in the present now, you help to break the link between the present and the past. You can find out more details about our program and how to access SHAPE on our website here. Thank you for listening.